Well, some of the nation's health advisors met today to endorse kid-sized doses of Pfizer's COVID-19 vaccine. That means the nation is one step closer to approving vaccinating children between the ages of 5 and 11.
And the FDA is expected to make its own decision on the shots within the next few weeks. News 8 Sierra Hignite spoke with parents today about how they're feeling when it comes to vaccinating their kids against COVID. Sierra, what do they have to say?
Regardless of whether the parent themselves was vaccinated or not, one thing they had in common today was when they told me it's different when it comes to vaccinating their kids. They say that there's more to think about and it's overall just a different process. Now, local health experts tell me that some parents have been waiting a long time for the day when one of these vaccines would become available for younger kids. If approved, the kids' dose of the Pfizer vaccine, which is 1/3 of that given to teens and adults, could be available as early as November. The Pfizer vaccine is nearly 91% effective at preventing symptomatic infection. Many parents still haven't made up their mind when it comes to vaccinating their younger children, like Meredith Neasley, who has 2 children that fall into the 5 to 11 age category.
I haven't really decided yet. My thought is to speak to their pediatrician about what she thinks. I got myself vaccinated, but with my kids, I want to speak to their doctor first.
Malcolm Cannon has 1 child who would be eligible. He and his wife chose not to get the vaccine, and he says they would do the same for their child, but says things might change if their school mandates it.
I don't think the vaccine, some people are scared of what it could do. I'm not necessarily scared that it would affect my children in a negative way, so I would be moving toward the side of doing it because it's not worth the education, losing their education over it, because we pay for a private school.
Both Cannon and Neasley say that it's different making that choice for their children than it was for themselves.
If something were to go wrong or there were side effects, I would feel stronger about it if it was in them than myself as a parent.
When I think of myself, it might be your own personal reasons why you don't want to, but as a parent, sometimes you don't want to invoke what you feel or how you believe about something onto your children. But at the very same time, you're trying to balance that between protecting them and being safe.
Dr. John Christensen, medical director of infection and prevention with Riley Hospital for Children, says that parents who have children with comorbidities have been waiting on the day that they can protect their children against COVID with a vaccine.
Obesity, children with chronic lung disease, especially asthma, may be at an increased risk, and you're going to have children that may have compromised immune system or have heart disease.
Dr. Christensen adds that it's important for parents to talk to their kids' pediatrician before getting the vaccine, especially if you have questions about safety or effectiveness. Reporting, I'm Sierra Hignite, WISH TV, wishtv.com, and follow us on Facebook.